So this is what I presented at the European Congress of Radiology in Vienna in March of 2023. The title was Real World Breast Cancer Screening Performance with Digital Breast Tomosynthesis Before and After Implementation of an Artificial Intelligence Detection System. Next. The purpose of our study was to assess the breast cancer performance of dedicated breast radiologists both before and after implementation of an AI detection system with digital breast tomosynthesis. Next. Our study was an IRB approved, HIPAA compliant observational study. The pre-artificial intelligence period began in March 1st, 2018 and ran through February 29th, 2020. During that period of time, we performed 54,440 digital breast tomosynthesis screening exams and identified 383 cancers. The post-artificial intelligence period ran from March 1st, 2020 through February 28th, 2022. And during that period of time, we performed 48,742 digital breast tomosynthesis screening exams and diagnosed 399 cancers. Next. This is a graph of our number of screening exams performed per month. The red vertical line demarcates the initiation of artificial intelligence in our practice. And you can see shortly thereafter, our screening numbers went to 0 due to the impact COVID-19 had on our practice. For a period of 6 weeks, we performed no screening exams at all. Next. And these are our results. We saw an increase in our cancer detection rate from 5.77 to 7.08 cancers per 1,000 women screened, which was an increase in 23%. We saw no significant change in our recall rate, which was at 6.96% post-AI. Our PPV1 also increased by 23% and was found at post-AI to be at 10.17%. Our sensitivity improved by 6% and post-AI reached a level of 86.47%. And our specificity showed little significant interval change after the use of AI. Next. So here's a graph of our 9 individual radiologists. The horizontal red line demarcates the benchmark of greater than 2.5 cancers per 1,000 women screened. The pre-AI bars represent the radiologist's performance prior to AI, and then the dark blue bars represent their performance post-AI. And as you can see here, every single radiologist showed improvement with the use of artificial intelligence, such that we saw a pooled improvement of 23%. I want you to specifically look at reader number 4. This woman found the most cancers pre-AI, but also increased her cancer detection rate with the use of artificial intelligence. She had confidence and trust in the product and increased her cancer detection rate. I want you to also look at reader number 8. This reader is different. She had a good cancer detection rate prior to AI, but showed no significant interval improvement with the use of AI. So it must be a matter of trust that she did not see changes in her practice as all other radiologists did. Next. If we look at the recall rate or abnormal interpretation rate, again, the horizontal lines demarcate the benchmark of 5 to 12%. We can see that all radiologists fell within benchmark or below benchmark, both with and without the use of artificial intelligence, such that there was little significant change in recall rate for all radiologists when the results are pooled. However, let's look back at reader number 4 again. She increased her recall rate, but remember, she increased her cancer detection rate. So AI was working for her. She gained confidence in it. Her recalls were appropriate and accurate, and she found more cancers. However, if we look at reader number 8, her recall rate also increased, But remember, her cancer detection rate showed little significant interval change. So she has not adjusted as well as the other readers to the use of AI. She's not as accurate in her recall rate, and she probably has a lot of false positives coming back in. Next. This is the graph of sensitivity, both pre and post AI, the benchmark being greater than 75%, and we see all readers performed above benchmark levels with the use of artificial intelligence. And overall, we saw a pooled improvement in sensitivity by 6%. Next. This is specificity. Again, benchmarks were reached of greater than 88%. Both before and after implementation of AI, but there was little significant interval change in specificity as a result of implementing artificial intelligence. Next. And this is the positive predictive value 1, or the number of cancers identified on patients who are recalled from screening. Again, benchmarks are between 4 and 8%. We showed improvement by 23%, which mimics the improvement in cancer detection rate.